tuna thalaka karon tarlan mipa pali te hi chiang devin han en wang ula kan hmel sha zong an omem le o hei Kolkata khopuya miron zong chuak wang maya mizo tlangwal rual kan ni e anin tia an hmel hi chiang devin han en ta ula kan hmel sha zong an omani chuan comment section lama kan no soi tho don ya o an chunga hian kan lom khop maya ole hei tuna hian mizo si pai tian nia hei hi Kolkata hian election awang hian duty nan ron oma hei tuna hian Birla Hospital an ron kalwanga heng te hi enge Birla Hospital an lo lu cha hian enge anwa man tin te danglam na te kan zo zoi toy te mi lo chang se
anuam khop mai am hun man thli re hin a fel fai a chung an lu te AC ni ngal vek mai box se anuam khop mai dam do in dang ne chane nang lo khop ma hei AC te an da lo nuam mi fel fai na a chung om te mi singa te po an fel hlom khop mai
Birla Hospital helai Alipur Kolkata hey kan han luta mapui lo oma hey anuam kan te khop mai AC an ngala hey achang tun mel khop mai
anuam khop mai hey apan na ni se kong pui kam mai ania parking le en kim har sam na mi le win helaya mun nuam tak le chang thung takin an lo oma thei sam chonin pan man na om hel khop mai
Birla Hospital hi ka voi khat kalna nia ka du ka rin dai na nuama achung po si fek ania ai anu khop baya dam lo han kala han nen tir tur tan po adai no me mani ke kan se du me
ale kan lo me kan zaban thala hau hal te ang o bo in hi fak na kan lo tin ni ta kan ya kan lo wai o kan ni ta kan bila shi ta sa don ya o hei ta min ron pan wang ni hi India ram mai po ni lo khovel pum hwa palung dam do in lar mai BM Birla Heart Hospital a shooting kan nei ni a BM Birla Heart Hospital an mo dan te an soi ve liama ti hian BM Birla Heart Hospital a thunei tu te po hi heng mizo tlangwal rual te wang hian an lom hle ni ole BM Birla Heart Hospital te wang hian mizo tam tak lom wangin an mit tui aluanga
hei dam lo na refer ngayin kan nu om ve tlat maya tiang chuan Birla Hospital a kal ngai ania kan hu por khop maya anti nge kan kalanga anti nge ti te kan ngai tu mek lain lowin en call to thren khat ten pi ma pui Tuesday nightmare nei tu no chu ni hi hospital a hian tlang tlak phok maya engkim mai men boi pui ani ti ten lo soya tiang chuan a guest house kan thlen thave topa engkim mai min boi puya kan thlen thak zana admit ngal ni in tu lang zong doctor te le ti tur ang zong te min boi pui zunga chu tiang chuan admit kan ni khan intar admit ngal hi tha thilakal chak du ti in admit ka kan han ni ngal ta tiang chuan admit kan ni chuan investigation te po amona engkim men ron tia atu ka min khoi ngala henga hian pima pui chunga hen kan lo hle maya tin hetia min boi pui na hian guest house kan theng ti mai lo chu engma extra charge le thil dang engma min bill tel hau lo maya an na tho hero pui kan ti mizo te tan thamon thak le ani ti kha kan soi du ani
hi building loi ya pui khwa ka nia kalung lampanga har sanna te nein ko ma te hian na choka hian to ka te min ho chowa shom takin hun re takan boy ya chuan Kolkata phai lam ri far ka ni angin Kolkata Birla Hospital kan jupana ta chuan nightmare ma pui mi fel men ami zo pui te ta na anun pum pui lan tu nen kim min boy puya achunga po hian kan lom ma yang chuan ke chu mars ni khan BM Birla Hospital Dr. Kuntal Roy Chowdhury an lo ting takin min zaya yang chuan tu na chuan ka om na thin le har san na ka to zong te kha la kya nen lo om ta kalome me ma ke ma ngalung lama har san ni te pon lo zo pan ve ula Pathiang ko ay na bangin lo dampui venge karing ani Birla Hospital, Birla Hospital. Vul zero se.
Lung chalo lung pop kania ka lung pop hi kalen no sha chwa chawani wangin alo zau deuh to a chuwa chuan ding lam press te hi asang to a doctor te po khan zeimei kha angam om to lo tura ngai ani a nima sela doctor kundal chowdhury an BM Birla Hospital Kolkata a lotling takin minzeya BM Birla Hospital Kolkata vuzero se
ke hi lung zai ngai kania sang ni som pariat atanga hun pui pan turati kha kani to a amai ro chusum le pa ya te har satna kan nei awangin kan kal thei lok lova Kolkata lampanin kan kalta a tichuan kalung chu tluang takin Dr. Kuntal Roy Choudhury an min lo sei saka voinia chuan dam takin kanate kathok le thei to ani Dr. Kuntal Roy Choudhury le BM Birla Hospital tichunga hian kan lom le a Dr. Kuntal Roy Choudhury te BM Birla Hospital damreng ro se
ke hi lung lei luang mual om kania lung artery pathum pakhat za phui to le pakhat za som riat phui to le za pakhat za som ko phui to ti in Ebenezer Hospital a lung doctor pu emesan nang chu helai khoi thei ni lova kari farang che ti a BM Birla Kolkata min ri fara chuta chuan doctor thiam tak tak tam takara Kuntal Roy Choudhury in min zaya kalung heart rate te hi niam em a mi te a normal za asom ruktur ani lain ke chu za asom ni pani chu ania chu min zai ngam lo lek lek nge a ma se tloting takin min zaya doctor Kuntal Roy Choudhury chunga le min boy pui tu pima pui chunga lom hle ani
hei lung lam sai ngain ka oma ti chuanin max zarzowin Mizoram Universal Health Care Zarzow Khanin Kolkata Birla Hospital Heart Hospital ka rin sai tira hei ti chuanin khuta doctor thatak mai Kuntal Roy Choudhury an min zaya losing khop mai ti chuan hei tu na hianin aizol lama ka khir le to Birla Hospital chunga kalom em ani kalome
kan nau le roi puya khiang te hi kum khat ani a lung pop awangin Kolkata Birla Hospital a minri fara zaiturin kan chuk tha a akhosik ana chata wangin kan zai theilok lova khuta mapui homestay ya kan thlenga ani in na trolin min lo buai puya chunga kan lom tak me ani chuan akhosik are nuwa Dr. Kuntal Roy Choudhury in thatakin min zai saka achunga kan lom em a tuna chuanin thil eite atuya a kg te po kan chuk tha ka kg rukha tuna chuan kg riat ani to a thil eite atui em a ama po a har tha a kan lom tak me ani Birla Hospital vulzel ro se
kan nau kum komi hi alum papa wangin hundrei takata kan wai to a Dr. Ten Minri Farangin BM Birla Hospital Kolkata lam kanon pan ve ta roi maya kan ru abwai hle maya hospital kan thlen tir atangin Dr. Kuntal Roy Choudhury an minlo bai pui em a lotling takin zai ani nu a tun thlengin har satna em nei lovin ala om a Dr.
kuntal roi chowdhury le BM Birla Hospital Kolkata chunga kan lom ani BM Birla Hospital Hulzer se
a then phe chu an nuai chuang an ngai dam lo tam tak anom to boka he video hi Mizoram lung na nei zong te na en chhuak vek turin ka du cheuba ka phaya hian engna chiang e ka thochin engwanga YouTube video siam man lek lava boy ta em mai nge kani ti te kani tin hun man dan mu ve shim du kha chuan atop thlagin milu en sak ve chho do ne o ole tu na kan mu hospital ro pui tak mai hi BM Birla Heart Hospital Kolkata ni in Braj Mohan Birla BM Birla dinani a world class heart treatment pek atum na thin lunga changa din ni in hospital hi cardiac heart disease diagnosis treatment le research center ta na siamani a BM Birla Hospital hi kapian madai kumsang zakwa somret pakwa dei to hon ania abulchan tir chang reng khan an doctor super specialist rwal an bon lomboka Eastern India heart treatment big pek na mun poimo taka an lo chang chhota ole hi kan soi to ang khan kan Birla Hospital bi ka hian healthcare a hen kan pu ber kan tia ama hi a fel em bia kan wa ma chuan ama hi mizo tong thiam lo ma se I enge soi du anei ve arin oma chu a soi du tlem te kha lo ti lan sak zoila
We welcome all Mizo patients for better treatment and quality in cardiology. Thank you.
okay no pang le pui tling lungda na sang en kol turin cardiologist le cardiac surgeon Dr. Thiamrwal tak te vil chot na hospital ania he hospital history an ming than na le rin tlak an ni lang sar zwal te chu India Rama NABH accreditation dongma saber hospital ania ISO quality certification shang dongma sapol hospital zinga antelbaka changkhat lian zet mai kumsom thum chuang changtlung takin lungda na nei te en kol le ti dam na hi lo thok to chinin India ram pumalung na nei te ta na khol chang kang le advance tak nei tu te ngi kan ti chuan BM Birla Heart Hospital hi ama sapola an ming achuang wa nge yang chu tiang khopa doctor thiam tak baka khol chang kang nei ko nga hian an ming thangani atoi zongin lungda na sang heart transplant valve replacement angioplasty bypass surgery le cardiac treatment engang chi po BM Birla Heart Hospital a hian antivek thaya
Mizo patients we welcome.
Thank you. I feel tapa mizo patient tan hianin thei pa to pa chwa chena kan lo em ani hei tu na hian admission room a kan om meka ta hian Mizoram atangin patient sang te Mizoram atang ron kal admission ti du ho kha helai mun a hian an ti thin hai didi hi fel taka oma a fel em ma te hian mizo te kha ti khan thatak le fel takin an lo chhon chin ani heng lai mi te hian chuwain kan lom em a he mun hi tun ma kha chuan mi ho sa te chawina an pan thei hospital changtlung le ro pui tak nie kan sha chen la yin he tu na van nei thak tak mai yin Mizoram healthcare scheme max kan ti tin hian anin thun zom ve lo maya he wang hian lungpop kan ti te lungna na sang naute se na changa pui ting tar te thlengin zaingai le ngai lo chi te po mizo tam tak a thon vekaronin zai lo tling ta hi kan tam ve to em a
Birla Hospital Kalaumatic.
ole khati zong khani ta se chuanin khilaya hospital chunga khian ward a khian Mizodam lo te an la omeka chungten te po chu interview na kan han nei amero chu mi ma in hemi OPD chung hi ka han fang chuak vel don ta ni chu ole han fon chuan han ta zuaila ole hi Birla Hospital a chuan Mizo patient te tam tak lo chan pui to thin tu ni
All Mizo people you are welcome.
he delai mon a hian doctor fel le thatak mai Mizodam lo Mizo patient te lo en kola lo duat lo caring tu doctor kan na ya doctor Madarumania a fel ani hi
I am not able to speak in Mizo language,
Yeah.
so I will talk in English. We see almost more than 100 patients, 100 Mizo patients, congenital heart disease in various age groups, like in neonatal age group, in infantile age group, and also as well as toddler, and also in the adult age group. We all, these Mizo patients are experiencing a very good result, surgical result, and as well as post-operative care. They all sent to home with 100% result, in the form of complete repair and complete well-being of those patients. Thank you.
mi he chan ti hianin an ni teng te pawh hianin he pa to ban chwa thian mi zo dam lo te dan kan lom thin em a chuan he ti la han kal le tai la an he mi Birla Hospital chunga han thingpui in anu nuam do le ya tui tak tlom box si a oma chu chu kal na kan hun kan nei do le tuna han kal don tai la hay kapu fel lot to kan ni a hay dam lo te alo do atin ti hian e kan security ten ni a thai nang fel em ani ale ole ti la ya hian hei dam lo patient te re hi achunga khian nom ta achunga tang khan kal tur chuan he mi khol hi Kolkata hospital a chon first time ani hian mai the tu tang khop chuan a khol he chang kanga ti hian khatia ka din pek ngai to lo khan khol chang scan me china an scan khan ti khan an scan khan ti khan he chang khan an chhomai to china to chwa all sam em a he lai han la thala focus ti lai chang hian kat in pek te in kan ni khatyang soi te kha ngai to lawa ole tu na hian no pang ward ta kan om me ka hi no pang ward floor b kan ya hi nurse fel tak ten atun han thut chela an fela no pang mizo patient ho te kha an lo kher em an he a fai nuam em bokan to han mizo patient nom dam lo no pang te ho kha lo duat em chin tu hianin mizo te kha welcome na thu soi toy te lo nei do na
You patient welcome in our hospital.
Ole ole he tu na hian basement ana thok ta pui bel care zong to po an wa ya han thok ve ka khang ho ru ma khan kanom ta tu na hian chuanin he tu na hian mizo patient te thei pa to par lo vil chin tu le lo tuam rom chin tu lo enkol chin tu te pan yan fel em ba kan lom em chuan mizo patient te chunga khan you want to say something?
Welcome in Birla Hospital, Heart Research Hospital. Provide good health service all the patient and provide always best service all the patient and that's it.
Okay, thank you so much.
Welcome to Birla Hospital. For the major patient, we will provide the best services and bed the cardiac hospital. So always we will welcome to come to our hospital and getting the best facility of this hospital.
Okay. Namaste. Ole hi tu na hian pediatric ward ta kan oma helai mun hi mizo tam ta na kan no pan chin no ward le helai mun a pri to na chang chuan kan dam lo di kan khat vek zela no pang hi dam lo kan nga chin din ba su bangin helai mun hi a lo lo te a thiang him lo te mu la ka du bangin dilai he kan han focus ni a tu na hai mizo dam lo no me boka an sai ho te ngem ti te kan so ran we nge khoi kwa chang ron kan ni le en mai te bằng xa tình mùa anh thì là doctor thì khăn dây rồi tím dây gốm tất điểm gốm tất mùa mai thì tổ là bếm mai na ông chi nó mì anh u khăn gì lệ vì Birla Hospital thì chúng ta làm thuốc liên khăn suy về xe
anh u cái này là anh nào cái nhà đang tập kinh cái nào anh dây rồi tím thì anh thì chúng ta chọn trong chắc sẽ không có tổ cái lúc tập sẽ là
Ole he tu na hian Dr. Kuntal Roy Chowdhury ilar mai famous mai kha kabula hian oma mizo dam lo tam tatin pukuntal hi anlo pukuntal kher hi anlo pan china pantu nei tam maya ama hi no pang le adult and pediatric kha no pang le puiting zai thei ania chuan CTVS doctor ania omza chu super specialist kan ti angkha ania tuna han zona tlem te kan anzot chandon ania. So Dr. S, first of all, how do you think why Mizo people choose you in your specialty?
So basically, if we see this hospital, this Birla Hospital is one of the first cardiac hospital in India, and this hospital has a legacy of more than 3 decades, and it has been one of the premier institute in cardiac, single specialty cardiac surgery, cardiac patient are getting treated here. So that is something special for any patient who are suffering from heart disease. They always seek something special care, and that is available here till 1990s. And this BM Birla Hospital is one of the best hospital in Eastern India and one of the topmost hospital in India itself in cardiac care. And we have all the specialties of cardiac like adult cardiology, pediatric cardiac surgery, adult cardiac surgery, electrophysiology, heart failure clinic. So everything related to heart is available here. So that's why it's a trust building for the last 3 decades, and patient trust to come here, and they get good treatment, good care, and they are very much satisfied.
Actually, you already have too many patients, we cannot even count. So what is your greatest strength as cardiovascular surgeon?
So, as you know that I got trained from different premier institute in India as well as overseas, in Australia, in USA, and those training made me to become a very good cardiac surgeon, and I am dealing with both the pediatric and adult cardiac surgery. So, doing adult cardiac surgery is challenging definitely, but doing more complex pediatric and congenital cardiac surgery is even more challenging. And you know that in last 2.5 years probably we have treated more than almost near about 100 Mizoram patient. By myself I have operated, and everyone was succeed except one. And though all those patient was different kinds of complexity, challenge, but the patients, every patient came here, got treated with our team, and 99.9% patients are very much satisfied with the care we given and the treatment. So it is all about our team approach, like our nurses, they are very much trained, we have protocols in place. So doing cardiac surgery is very challenging, because you know that after surgery and even before surgery they come in very compromised state, they have very different, patient has different complex heart disease, and doing the right thing at right moment is very important, because in cardiac surgery patient and cardiology patient, any heart patient, every second matters. So everybody in the hospital is actually taking care of the patient, especially our trained nurses, they are at the bedside. So they detect first if there is any abnormalities. Before we come, they always take the initial steps. We have protocols what to do, and they do their best. And that's why we have a very good outcome, and we can do this level of care.
How did you handle like too much complication of the patient?
So complexity of the patient is different from what you see in the Western world and our India. Because in India most of the time, even in pediatrics and adults, everyone comes very late, because once a doctor is diagnosed that this patient needs surgery, the patient is actually always scared about surgery, and they always delay due to some finance, due to fear, due to superstition, multiple reasons. And when they come very late, that itself actually complicates the disease. So if a patient has very poor heart function due to any reason, and if they are delaying, that means probably they are doing more harm. So this timely treatment, we want every Mizoram patient or every Mizoram individual to make aware that the timely treatment is very important. So once a doctor is suggesting that patient needs surgery, means they should not delay. So delaying actually increases the complexity. And if you see that managing the complexity, we have different level of trained and expertise people here, everyone like cardiologist, cardiac surgeon, and we take care of the patient, we know the complexity and we know how to handle the complexity. So if we plan accordingly, then we can manage the patient beautifully, and patient can get a very nice outcome.
Anything about like you want to tell to Northeast people, not only Mizoram, Manipur, Nagaland. So if you want to tell something about it.
So basically, what I would say that detecting the heart disease is a challenge, especially when the patient is suffering from congenital heart disease. Because congenital heart disease is not detected when the baby is in mother's womb, and that is actually the standard in Western world. So every baby should be born with a diagnosis if they are suffering from a congenital heart disease. But that is not the reality in India. But this fetal echocardiography, the echocardiography done when the baby is still in mother's womb, and that is actually a very good tool to detect the congenital heart disease at the earliest. And if we can detect that congenital heart disease at the earliest, then we can do planning that when the patient needs surgery, when the patient needs other type of therapy or other type of treatment.
Or in early stage medicine can
yes, or medicines, yes. So that planning is very important. That is number one. Second is whenever a congenital heart disease is detected or a adult patient heart disease is detected, as I already told, that early referral and early treatment is important. So don't waste time with all this superstition or other social stigmas. So come to us, we can guide you, we can discuss with you what is the treatment, what should be done, and then we can go ahead with after discussion. And for the Northeast people, the another thing is follow up. So once we do the surgery and once we do some stenting or any other procedure, after that cardiac surgery needs follow up. So every patient from Mizoram, they cannot come again to Kolkata for follow up at BM Birla. But we can actually develop a good, in nowadays we can develop a very good follow up with liaison of the local doctors. That we can definitely plan in future, in near future, that every patient, especially those complex cases, we can do like a video conference with the local doctors, so that they are getting followed up at local doctors, but those reports and everything is coming to us and we can give our opinion. So it is a friendly discussion with the local doctor and our specialty doctors. So the patient will be benefited with that kind of service if we can provide. That we can plan in the near future for better follow up of the patient. And if they can come during follow up, they are always welcome. And another thing another thing is that is actually it's a good thing that the Mizoram patients are usually very fair complexion. So if they have a cyanotic heart disease, that means the baby gets turned up blue when they cry or at rest. So they actually get very quickly detected that they are suffering from a cyanotic congenital heart disease. So these are few points what I want to mention. And I would also mention that we do and I do all the pediatric and adult cardiac surgery from neonates from 4 days old, 1 day old and 75 years old. And we also do all the sorts of complexity, whatever is available in complex congenital heart disease. And I would also mention that we are also doing some minimally invasive cardiac surgery even in children. That is very new things, and in children that is very sometimes it is very rewarding for the doctors and it is very much satisfying for the patient, because in India, if especially for the girl child, if they think that after surgery there will be a big scar at the midline, many parents are actually afraid of that scar and they don't want that scar. So now we have started to do a very minimally invasive surgery, just cut below the axilla so that scar will be hidden and the patient will have better recovery. All the surgeries cannot be done with that, but we can do few surgeries. We have done one Mizoram patient last month, and she recovered nicely. She was 5-year-old with a hole in the heart. And we did the surgery with a minimally invasive approach with just a 4-5 centimeter cut just below the axilla. So parents were highly satisfied with that scar. So all these service we can offer. We can offer the best care in Eastern India. The BM Birla is trusted, and we are determined to serve the nation better and serve the Mizoram patient better.
Okay, the last question. There is a lot of heart hospital in the whole world. Why would Mizoram people will choose BM Birla Hospital? Like, what is the unique of Birla Hospital?
So, as I told you that I have worked in the multiple hospital in India and also abroad. And then I came back and I joined this hospital because this hospital is more than 3 decades with high grade, advanced technology, the highest level of expertise, the all spectrum of congenital and adult cardiac service is available here. We have the very advanced technology, very advanced machines, and also we choose all the expert expert doctors, nurses, and everyone, professionals. They are working here. So we can offer the best level of care, and probably that's why that we are delivering for less than 3 decades, more than 3 decades. That's why I think the BM Birla is unique. Yes.
Okay. Thank you so much, Doctor. Ol hai tuna hian BM Birla Hospital Dr. Ruma kanom meka tuna hian interventional cardiologist thiam tak mai BM Birla Heart Hospital Dr. Pumalpania kan komdona. Doctor, how to prevent heart attack?
See, before we say how to prevent heart attack, we must know why does it occur. Because only when we know how it occurs, then only we can think about prevention. So as far as our present knowledge goes, there are certain risk factors which causes heart attack. And the most common among them are diabetes, high blood pressure, high cholesterol, genetic tendency, and smoking or tobacco in any form. So these are the major causes. There are certain minor causes also, like sedentary lifestyle, central obesity, a type A personality where there is always a tension, it rises very fast. So these are the minor causes. So whenever suppose a person is diabetic or hypertensive or high cholesterol, they should keep these things under control. Okay. You should stop smoking or using tobacco in any form. Do eat balanced food. Take as many fruits and vegetables in your regular diets and the pulses and all. So these are the ways you can, and then every day you should walk 3 to 4 kilometers. If you are obese, try to shed some weight and keep your BMI under control. Try to avoid sedentary life and walk every day 3 to 4 kilometers, brisk walk in 40 to 45 minutes per day. These are the main causes, and that is how you can prevent the heart attack.
Okay. Actually, nowadays, young people are getting a lot of heart attacks. So, how do you think? What is the reason?
See, I have seen many of late, last maybe few years or last 1 decade, the incidence of young people getting heart attack is becoming increasingly common. And this is particularly so in the Southeast Asian countries, including the India, as compared to the Western population. The few causes which I can think of is the sedentary lifestyle, lack of exercise. And these young people, these IT guys, they are always in stress to meet their professional demand, or always they wants to achieve their targets and all. And because of their working style is also different, they sleep during daytime, they work late at
Yes,
night,
exactly.
and their food habit is also they always want to go for a fast food, very less fruits or vegetables in the diet, and lack of exercise. These are probably the common causes for them. So these people, even though I know they are busy and everybody has to earn his livelihood, but still they will have to take out at least 1 hour for their body
Yeah.
and do physical exertion and eat balanced food,
Yeah.
go for exercise, and as far as possible try to reduce the tension, go for meditation and all. These are the ways we can prevent the heart attack.
Yes, yes, exactly. And what is the early symptoms of a heart attack?
See,
And
rather than saying the heart attack symptoms, I would say ki acute coronary syndrome or chronic stable angina. Initial days, whenever a person gets either breathing difficulty or chest discomfort or burning in the chest on exertion and relieved by rest. So the person will give typical history. Whenever I walk 200, 300 meters brisk walk, I get some tightness in the chest or burning in the chest. And as soon as I stop, within 1 or 2 minutes, this discomfort decreases. These are the most surest complication symptoms of heart problem. And suppose this discomfort even radiates to either jaw or neck or arm, then the chances become even further. This is definitely a cardiac pain. So these are the causes of these early symptoms of the heart attack. But these symptoms doesn't occur in all the patients. Sometimes the first time a person can get a chest discomfort, it can be a heart attack also. So whenever any central chest pain or burning or discomfort which radiates to arm or neck or back, where there is a profuse sweating, and somebody, as if somebody is squeezing you from the inside, and the most important, the problem people get confused with is the cardiac pain, heartburn or reflux esophagitis. So everybody has got some experience about the reflux esophagitis. Whenever we eat food and get acidity, we have. But if you notice, this discomfort of the heart attack is totally different from those reflex esophagitis, because I have seen many patients who spend hours at home treating this condition as a gas, and by the time they reach hospital they are late. So every patient I ask, see, in past also you have suffered from acidity, was these symptoms the same as it was in the past? They distinctly say no sir, this time it was different. So whenever you get these symptoms which is different from the previous discomfort of esophagitis or acidity, you should immediately rush to a nearest hospital, get an ECG done, and then rush to the hospital where intervention is available. And if in your area, if intervention is not available, go to any center where there is a ICU and the facility for thrombolysis is available.
Okay. In cardiac treatment, what is the role of the main role of BM Birla?
I'll tell you.
Yes,
BM Birla being a tertiary coronary care center, we have all the facilities to treat any sort of cardiac emergency. So the golden rule of heart attack is try to reach the center to in the care of the hospital as early as possible, and the initially golden hour is the most important. Because see, once you get heart attack, your heart muscle starts getting damaged, and if you reach within 1 or 2 hours, the chances the damage occurs to the heart is very less. But as the time passes, the damage increases, and when you reach the hospital beyond 6 hours, almost 80% damage has occurred. So if you reach early, your damage to your heart is less. So whenever a person with a heart attack comes to our hospital, and as soon as ECG is done and heart attack is diagnosed, we have a coding system. Immediately code STEMI is announced, and code STEMI means everybody will be geared up to take that patient into the cath lab as early as possible.
Yes, sir.
The doctor will immediately rush, anesthetist will be ready, cath lab becomes ready, and this barber comes and immediately prepares the patient. Everything we do very fast so that our hospital to first contact time to the cath lab time is less than 60. It should be less than 60 minutes, but in our hospital it is even 30 to 40 minutes. So we do it very fast. By doing so, whatever damage occurs to the heart we minimize, and that is the whole game of treating a patient of a heart attack, so that they should get less damage to their heart.
Which means if they have chest pain or if anything heartburn, they have to come immediately
To the hospital. And suppose even if suppose they come to the hospital, immediately we do the ECG and all, it may turn out to be esophagitis, but it is still worth going to the hospital early, because if it is a heart attack, then you can save a lot of your myocardium and heart muscles. If the person is staying in a hospital where in area where the facility of primary angioplasty, what we call as, is not available, they can go to any center where they can be thrombolized. There are medicines available which, given the chances of recovery or recanalization, is in the tune of 60 to 70%. Means in 60 to 70% the blocked vessel will get opened by those medicines. So at least 60 to 70% relief will be there to those patients where this facility for primary angioplasty is not available.
Okay. Ala hay tiyan kachian nu ne tina kachian nu routine ha tak po soi la vin ha po soi la miron katel pui wang wanga kalom tak za za ni ti kha kan no la kan ala tan la ko ro pui la kan kalom tak za za ni ti kha kan lo soi tel le do ne ole rote hi kan sha tangin Charnok Hospital ason Charnok Institution ason lecturer in Omeka BSc le MSc lecturer in Omeka chu menge mi zo mi puite khan mi lo sha sak chho don ya ale he heng ten te he di teng te an fel ma heng teng te po hi mi zo patient te khan lo care lut to kan heng ten te hian kan lo me thank you dhanyawad okay